Hi there, my name is Tim Dreher. The following exercises are for people who have neck pain, either general neck stiffness or arthritis or perhaps even a herniated disc. The first exercise that we want to do for the neck is to very gently look down at the right armpit. We look down and over. Just let the head take it down on its own. We don't like to apply extra weight with the hands. And we hold that stretch for 30 seconds. We now come over to the other side and feel a stretch. Always when you're stretching the neck, you should feel it on the opposite side. So if you're looking to the left, you should feel the pain, or not the pain, but the tightness on the right. If, however, you feel something on the same side, tell your therapist, because that shows that a bone is out of place that we need to work on and do a chiropractic-like maneuver to put the bone back into place. So that's the first stretch. The next one is to gently turn the head to the right and feel a stretch along the left side. And if your therapist has shown you, you can take your right hand and go into the place where you have the muscle knots, and you can begin to do your own massage just like you did in physical therapy. What they might have shown you was to start at the neck and work down, or they might have told you to go right onto the muscle spasm and start to go back and forth like in a sawing motion, or perhaps they told you just hold the pressure for about 30 to 45 seconds to take away the muscle spasm. That's turning the head to the right, and now we turn the head to the left, and we can do the same thing with the massage. Again, remember the stretch is always felt on the opposite side. If it hurts to go to the same side, so for instance, if you had pain turning to your left and you had pain on the left, you would not want to do this stretch because you're just going to aggravate. You're basically banging bone on bone, and that's not going to help any. Our next stretch is where we cock the head, so we side bend to the right, feel a stretch along the scalene muscles, and again we can take your right fingers and start to massage that area and loosen that. And holding that for 30 seconds or 5 deep breaths, in for 2 and out for 4 to help the muscles to relax. And after 30 seconds we switch sides, and typically we do 1 or 2 times of each exercise on each side. Again, only to the point of stretch, never to the point of pain. Our next exercise is a little bit more advanced. It's a trapezius stretch where you cock the head to one side, but then look up at the opposite. So cock to the right, twist your head up to the left. That'll give you a nice stretch on your upper trapezius, and again, only on the left side. And then we come up and switch to the other to get a stretch on the right side. Holding that for 30 seconds. And then coming back to center. The last one is where we just drop the head straight down and just let the weight of the head come down and get a nice stretch in the back of the neck. You may even feel it down towards the shoulder blades, but no more than that. If you have pain that goes all the way into your low back, tell your therapist. That shows that you may have what's known as neural tension, that the spinal cord, the nerves are actually too tight and need to be worked out by your PT. And then holding that for 30 seconds. So that is a general program for just stretching of the neck. If, however, you have a bone that is out of alignment, or you have a herniated disc, or you have a problem with your facet, then there's a couple other exercises that we want to do. So first we're going to turn sideways, and we're going to do the chin tuck. So many of us get into bad posture where we're rounded, our head is forward. It is one of the worst positions for the neck, because when Audrey rounds and slouches, she puts a lot of pressure into her neck. So coming up nice and tall, and now we just take a finger and put it on your chin and gently tuck the chin back, and it's just a slight forward and back motion 15 times, not really holding. And if there's a bone out of place, this is a great way to start to put it back into place. And gently just going forward and back for 15 times. After we've done this exercise, we can now do one lying down on the bed. So we're going to do that next. The next exercise for the neck is specifically for people that have a bone that's out of alignment. This is from Brian Mulligan. You'll gently be lying on the bed, and you're going to scoot your head back so it hangs just a little bit off the edge. That hanging of the head creates a traction. It opens up the space. We'll try to go a little further if you can. And while the head is hanging, just let your body relax and let the head gently open up the space between your vertebrae. Your neck has 7 vertebrae, and we want to have enough space so that when they move, nothing bangs bone on bone. Once your head is gently hanging, we start to very slowly roll the head left and right. And you probably had pain on one side. That on your left side, when you tried to roll or cock the head, you had pain. What you'll find is you're able to actually do this when you are lying down on the bed, And now as you start to loosen up, you can start to move the head further and further in each direction. And this twisting of the head back and forth 15 times loosens up the joint, opens up the space so that anything that might have been caught or snagged or a nerve that's being pinched can be opened up. So we go back and forth 15 times. Obviously, if it hurts to have your head this far off the edge, you can just do it regular lying down. And while we're here, we can also stretch the neck. So if your pain was on the left, we'll turn your head to the right and just hold for 30 seconds. You can take your right hand and use that to start to massage the muscles and loosen that up. And that's what you were probably able to do sitting, but maybe you weren't able to do this line, you weren't able to go to the left. But now that you've done this, now you can turn your head to the left, and you probably won't have the same pain you had before, and you can actually start to get the flexibility back, holding the stretch for 30 seconds. So these are the two best techniques for getting the neck back into alignment on your own, and then just tell your therapist where the pain is, and what we'll do is to actually just come in, have the weight of your head completely supported into my hand, take a deep breath in, and relax. We begin with traction, just gently opening up the back, bringing back the space between the vertebrae. We'll hold for about 30 or 45 seconds. And that's the first piece that the therapist will do. The next will be massage to get rid of the muscle knots. And then lastly is similar to chiropractic, where we'll actually go right onto the bone, find the one that's out of alignment, and gently put it back into place. We're not the kind of folks that do the quick snap, crackle, pop, rather just a very gentle easing of the bone back into place. And there's ways that you can actually do the same thing yourself to put a bone back into position. And those are the exercises for neck pain. Thank you and good luck.